Hey, everybody. Welcome to Meddkit's Provider Spotlight. And we are here today, always talking with amazing private practices, hearing about their stories, hearing about what they do, how they help their community. And I feel like I always learn something new every single time and excited to bring all the experts to you. I think that's the best part of this is people who are really well known, fabulous, that have a lot of insight. And so today we have Dr. Joanna Chan from Dynasty Dermatology in California. And we're so excited to have you. So thank you for being here.
Thank you for having me. I'm excited to be here.
Yeah, I know we have a lot to dive into. I'm excited for it. I know you have a wealth of knowledge that you're dying to get out there. So, but why don't we start off a little bit about you and what's your story and tell us, what kind of inspired you to open up your own practice?
Thanks for asking. I was actually not born in America. I was born in Burma, which is now known as Myanmar, and came to America about age 4 and came straight to Texas, where I grew up and graduated high school. Being an immigrant, it was interesting, a struggle, but I just saw such opportunity and really felt inspired to live the American dream. And was very excited when I got in early to Harvard College and studied biochemistry, went on to Stanford Medical School, and did my internship in the Bay Area and came back to Dallas for training. Fabulous institution, got lots of hands-on surgical experience. I was able to do flaps and grafts for the vets in the VA, which is the busiest VA in the nation, starting my first year in residency. And so that was incredible training, got to work with plastics. Finished my dermatology residency and then decided to pursue a 1-year surgical and cosmetic fellowship. It was combined. It's called a MOHS micrographic surgery. It was accredited by the MOHS College. It was also a cosmetic fellowship, so we learned how to do lasers, fillers, liposuction, facelifts, chin implants, kind of the whole gamut. And I really enjoyed having access to all the devices, lasers, tattoo removal, kind of everything, and still keeping up my general dermatology skills and Mohs surgery, of course. And so really, when I was growing up, I wanted to cure cancer and I didn't know how I could do that. And really, I feel like the skin is one of those specialties where you can legitimately almost cure cancer with a 99.9% cure rate using Mohs surgery. So I'm really excited about that. I get to cure cancer and make people look beautiful and feel kind of the way they want to feel by looking the way they want to look. And so I find a lot of value in that. I think that it's important to have that sense of identity and not losing that when you have to face cancer. So that reconstruction part of it is really great. So that's kind of my biography. I ended up moving to Long Beach. Well, I moved to Manhattan Beach in LA right after fellowship because I wanted to work in Long Beach, which is my first practice. I ended up being a full partner after 2 years. And it was a very large practice, very similar to my fellowship. And it was great. And I was also, dating my husband who was practicing in USC, Pasadena. So we ended up moving close to that area. And I, about 5, 6 years ago, transitioned my practice slowly kind of up north, Pasadena. I did work kind of all over LA, Fullerton, Arcadia, downtown LA, Torrance, kind of just figuring out my next path because I really wanted to stay a Mohs surgeon, which is where we do real high level care for our patients. And so I found the perfect practice. I have amazing colleagues. And about 2 years ago, they were kind enough to allow me to help kind of take over and manage it. And that kind of became a new start for me as a more entrepreneur and kind of a creative part of medicine. And so it's like true private practice. And there's been a trend lately in dermatology to be aligned with hospitals or private equity groups because safety in numbers. And I think there's value to that. And at the same time, I really value the autonomy and the ability to stay nimble in times of change. And so I think that dermatology is one of those like final bastions where patients can really refer themselves if they have an issue and they can help take care of themselves either through insurance or electively. And it's a great intersection of art and science. I don't know, I could go on and on. So
I love it. No, I like love your whole story. I love how you came here as an immigrant and had this like really great hope for the world and like what you wanted to be. And then you totally took action. You're like, yeah, I'm going to go to the best schools that America has to offer. And then I'm going to study, 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 get into some really great programs and then doing what you love now, which is curing cancer, which is something that you've always wanted to do with a very high success rate, and then helping people feel good. And I think who doesn't love that, right? Who doesn't love to make people feel good and help people, you know?
Right. And I think most importantly, in a safe and nurturing and kind, ethical environment, right? Because I think that a lot of companies or just places out there are really limited by trying to just survive and make that buck and kind of cutting corners. And I feel like our practice has been in existence for 30 years, even though I've kind of taken a new spin as Dynasty Dermatology. We do train residents from Huntington Hospital, which is now affiliated with Cedars. And we have a resident right now rotating who's going into dermatology. So it's really nice to kind of stay relevant and also up to date with all the latest technology and actual data, because I get asked all the time, can I do XYZ, different animal parts, put on my face. And I don't, I really prefer to look at the data. And when I advise patients, I really try to give them all the risks, benefits, alternatives so that it's like true informed consent. And so
Yeah.
yeah, that's really nice to feel like you're practicing in a way that you really feel that's best for the patient.
Yeah, it's important to feel heard and then also really safe because, it's it is very personal. When you have a doctor any kind looking at you and, it's you're totally open up your world to them. And so you really want to feel good about that environment. And so I love that, over the past few years you have, taken over, kind of opened this, put on this entrepreneur hat on and able to continue your work in a different capacity too. So that is awesome. And just to kind of like change pace a little bit in terms of how you help people, what would you say is like the most common things that you treat or areas, or what do you find people right now are like really struggling with?
Sure. I mean, I think you can look at it from the medical point of view and then also the cosmetic aesthetic point
Yeah,
of view.
would love
So
to hear both. Yeah.
right. So, I mean, in terms of the average person who is concerned about their health, trying to take steps to stay healthy and prevent issues, I think the number one thing everyone should do is a skin check, right? Because 1 out of 3 Caucasian Americans get skin cancer, 1 out of 5 all Americans. And I've unfortunately had to operate on plenty of 20, 30, 40-year-olds of all ethnic groups, not just Caucasian skin, but Asians, Latin Americans. People are surprised at how many people actually get skin cancer, especially in a sunny environment like California. So I think that is the thing that people struggle with most. They're concerned that this thing on their body is changing and they just want it off or they want to know what it is. So I do that a lot. That is the majority of my practice is the Mohs surgery, where we take out the cancer really, really tiny, check the margins while they wait, and then we can take a smaller margin and then also reconstruct it in a really nice, beautiful way. So that's what I do most of the time. But then aesthetically, I think people just want to look the way they feel and they don't really know how to achieve it. So what they struggle with really is how do I take that first step or how do I look kind of like me, but still improved, or just kind of improved and refreshed, not different. And so I think people look to dermatology rather than sometimes plastic surgery going under the knife, so to speak. And so we're here to guide that process. It's a very challenging, kind of overwhelming process. And there's a lot of psychology with it, a lot of feelings. And I think it's really important to kind of break it down in a kind of manageable way.
Yeah, no, I love how you said that there is a lot of psychology behind it. There are a lot of feelings that go into how you feel about yourself. And, being very careful to navigate that with the patient. I'm sure it can be difficult at times, but also knowing like kind of what is best for them.
Yeah.
And, giving them that boost of like, hey,
Yeah.
this is what I really think. And I can understand that there's a fine line with that.
Yeah.
Yeah.
Yeah, I think that people do really have a lot of anxiety around looking too different or, some of the possible results that they aren't wanting to or intended to have. And so I always try to give them a mirror and have them look in it and I ask them like, what actually bothers you? Or how do you feel when you look in the mirror? How do you want to feel? And if it's something that it aligns with what I think, I will definitely kind of pursue it from there. And then if it's something that is totally not noticeable, I will also share that from a professional point of view. I'll say, that does not detract from your beauty or whatever it is. Have you ever considered this? And, just saying it in that way kind of sparks conversation. And it's not meant to be am critical or, it's really meant to give you the expert opinion as to if you want to look a certain way,
Yep.
maybe take a different approach rather than the cookie cutter approach.
Yep.
Yeah.
I love that. Yeah, there's so many different ways to do it, and it seems like you have all those like really great tools from everything that you have learned, that you have done. This is not just this is the only path you can take, you
Right.
know. So
Yeah.
I love that. And speaking of approach, how would you say your approach is different than other people? I know we've kind of touched on some things here and there, but can you expand on some of those?
Sure. Well, the thing that was most important to me when creating Dynasty Dermatology was to really help the patient have that experience of family, right? So they can walk in, front desk greets them, excited to see them, knows who they are, and helps them. And we want to care for them in a way that makes them feel like they're a real person instead of like a number. And so that was really important to me. Also, I mean, efficiency, right? I mean, nobody wants to waste their time. It's so hard to get in to see the doctor. And so we have text messaging, for them. They can request email, kind of just to give us their information. If they're looking in the middle of the night, they don't have other time to call. Like we will figure out a way to make it happen. So, and respect, obviously, we do want to treat them like a human being and not just a problem to solve or, sometimes doctors don't always hear what we have to say because they're kind of in a rush and kind of think they know it already. Sometimes it does take some investigation, and I think what's different from us for us is that we do really have that level of expertise and like sub-specialization. So it's not like we do everything. All of us do everything. I mean, we do because, when you go to medical school and you do dermatology residency, you have that foundation. But we also have people who are really interested in acne, really interested in hair, really interested in cancer and aesthetics. So it's really neat that we have experts in things like leprosy working in our office. And it's just kind of feeling like everything's going to be okay because it's one stop, but yeah, you have the experts to help you. And that's actually how, sorry to interrupt, but that's how I came up with the name Dynasty. I actually did a little focus group and I said those words like family, tradition, enduring, expertise. And this one lovely woman said Dynasty Dermatology. And I mean, thanks to her, I have that name, but it was really born from that feeling of wanting to take care of family.
I love that. Yeah, you want to be treated like family. You would love to go somewhere and feel like you're comfortable and warm and like, oh, I'm going here and I'm excited to go because I know it's going to be great.
Yeah.
And I think,
You're getting naked on the first date, so
yeah,
so I mean, well, protected, covered, but still, we're trying to look everywhere, and so you do have to trust the person you're letting to take a look at you.
yeah, I love that. Dynasty, very cool name, but I also love that the whole meaning behind that. I didn't think about that, but that's why I love, doing this. Like always hearing people's stories. What's the background? What is the feel, the vibe of, what you're trying to do, how you're helping your community. And so just as important as everything else. That's awesome. This is probably one of my favorite questions to ask. And it usually sparks some very interesting comments and ideas, but I'm sure there's a lot of misconceptions about what you do, procedures, or how certain things are done, or some things with certain conditions. What do you think are some of your top misconceptions that you feel like you're like going off like a broken record about all the time?
Right. Well, I think one really common misconception among the medical field is that what we do in dermatology is easy. And I really don't think that. I feel that we went through years and years of training myself, 13 years of school. And I do work with colleagues that, aren't exactly MDs, but that means that they're nurse practitioners or estheticians, or they have a specialized focus. But I don't think what we do is easy. I think after years of training, you can be rapid in the diagnosis and efficient in the care. But a lot of times you'll go and it'll take like 5 treatments or 5 visits before you can get kind of address the issue. But what we do is not easy, and what we do well, when to do it well is even more important. So that's one thing. Another thing is the proper training when it comes to aesthetic procedures, right? So yes, you can take a weekend course and you can probably effectively administer something like Botox. But I think it's art. I think that needle carries medication and it needs to be targeted to the right tissue planes and the right muscles and in the right way in an artful manner so that you look normal. You still have movement, you still have expression, and you don't look angry. That's what we're trying to not look like. So I think it's important to go to someone when the procedure could potentially be complicated as well as risky if you're not in the right hands. And so and the other thing is, some people think like one syringe or one treatment is going to like make them look like when they're 20. And it's just not possible. I wish I had that magic wand. And one day when it's invented, I'll for sure get it. But it's not there yet. And I feel like it's kind of a journey, right? So it's not like I can just go and get it fixed and it's done. It's a relationship, right? It's like your hairdresser, it's maintenance. And so I think people need to understand that there is some investment, time, energy, money, like all those things, and we are sensitive to that. So you just want to go somewhere that's not trying to rip you off, right?
Yeah.
And having them suggest the hammer because that's all they have. But really to tell them, well, that's not the best treatment for you right now, and maybe do this first because that's the most efficient way to get to where your goals are. And then the maintenance afterwards, like a not common misconception is I can just get a laser and like never take care of my skin. So no, I mean, you wear sunscreen. So there's so much you can do with skincare and 90-minute procedure that we can help educate you about. And so that's common misconception. And then the final one, which I is very dear to my heart, is Mohs surgery. So in recent times, all dermatologists who report that they've been doing Mohs surgery can take a test. They don't check if you've been doing it. They don't ask for a number of cases. They just say, okay, well, if you've been doing it, you can take this written examination. And by passing this one written examination, you can become board certified. So you don't have to do a fellowship. And this window is closing. So the spigot's going to be turned off. But right now, there are people who have this board certification, including myself, because I took that test. But then some of those people don't necessarily have fellowship training. And I'm not saying that they're bad or unqualified or anything like that. But I do know I learned a lot in my fellowship training, and especially the pathology, to get that curate and to really understand the nuances of what's benign and what's malignant is actually very challenging. And so I feel that just being board certified is not enough. And that's crazy to me. I think you should look to see where they trained and how they trained and how many cases they've done. And I mean, I've been a doctor since 2006 and I've been in practice for 13 years. Kind of insane to me, but so I've done well over 10,000 cases on the face, all over the body. So I feel like at least I have colleagues I can call upon if I need help or I know how to deal with really complicated cases. And if I don't feel like I'm the best person, I will definitely refer you. But I feel confident that I can give you at least a yes or a no. Like, am I the person for you? And in the manner in which you want to be treated.
Yeah, no, there's so many, and I love all the categories of misconceptions. And like, even just starting with a couple of few, that skincare is a journey. There is no magic wand, and just got to be a little bit patient. Like, I know what you might see on social media, and you get this one injection, and then it's like, boom, okay, you get everything that
Right.
you wanted in life. And like, that's not the case. And
Right.
I think it's really important for people. We live in this like very high satisfaction world. And we get things like Amazon shipped in 2 days, and
Yeah.
skincare is not Amazon. And so
Right.
I think that's really important to point out, and something that we probably don't talk often about.
Yeah.
That we have to be a little bit patient with our skin, with our body.
Right.
And just the thing about the Mohs surgery is absolutely wild. So just kind of like double clicking on that, if someone takes this written exam, becomes board certified, maybe they've never even performed a Mohs surgery.
That
Yeah.
is correct.
Hey, yeah.
That is literally correct. They'll
Yeah.
be board certified in it.
Yeah. That, something a spotlight I was talking about with someone earlier is, ask questions. And I love that you were like, yeah, you should find out how many cases they've done,
Right.
they have studied, and you should you should be more educated in this, because it's only going to help you kind of steer clear of things that could be harmful to you in your care. So
Right.
that's
And
crazy.
and that's kind of why I love working in Pasadena. I feel like we have the Caltech population. We have really amazing patients that have lived there for decades. And I mean, I think we're one of the practices that doctors send their family to and that they come themselves. And, I think it's important to figure out, the before and afters, like really look at them and see if the way they look is the way you want to look, you know? And so I think that you just want to feel that you're going to your doctor and that you can trust them. And having that relationship is kind of everything. And everything comes from there. And it's important to feel safe.
100%. And, speaking of, some extra tips after you just talked about some misconceptions, but are there like a few tips that you might give regularly to a patient or things that we can do better today that we can, you know, do so much better of a job of taking care of our skin? Or is there something that you're like, if I were to make a dermatologist like to do wish list, if everyone across the board could do these couple of things, this would put everyone in like a whole other category. So what do you think those things might be for everyone?
Well, I think really just be aware, right? I think people notice things on their body all the time, but they're not intentional about it. And so whenever I do my skin exam, I always tell patients, especially female patients, always check your breasts once a month, like while I'm checking them. And then while you're doing your breast exam, also check your skin. Have someone look at your back. Men tend to get melanoma on the back. Women tend to get it on their legs. These are places we don't always look, the back of, and so really just, enroll your family members. And, if you don't know what you're looking for, just make an appointment. I mean, it's so easy to take a 10 to 15-minute exam and just have peace of mind. And then they can tell you how to look for things and teach you. So really get checked. That's like number one. It's just like getting, sometimes people don't like going to get their doctor visit, their preventative care, but this is important. I mean, it'll also help you establish a relationship in case you get a rash or you get an acne flare or hair loss. I mean, then your doctor can see you right away because they already know you. It's not like months to get in. So that's one thing. But then also, like I mentioned before, skincare is so important. It's so much easier to treat people who have taken steps in prevention, right? So before you get insanely wrinkly and brown spotted, like reapply sunscreen every 2 hours, wear the right kind of medical grade sunscreen with zinc and titanium dioxide, ingredients that won't give you rashes. I love vitamin C and antioxidants. I do personally use growth factors that are safe plant-based. I love hyaluronic acid. That's topical. That's the basis of what is injected for filler. So it's very safe, a substance your body naturally makes. It kind of regulates your skin, keeps it calm. So I'm also a fan of kind of minimally invasive things like microneedling, baby Botox, like not too much, just kind of before the wrinkles get fixed. So these are just kind of pro tips, but we could go on and on. And the last thing I would say is really treat that age-defining feature. Sometimes people want to do like laser or their neck or whatever, but people aren't really always looking at your neck, but they're always looking at your eyes. And so one of my favorite procedures to do under local anesthesia is like a 45-minute nip tuck. We just kind of remove the extra skin and the stitches come out in 5 days. So it's pretty great. People are surprised at how little pain there is and how they can look basically 10 years younger with one procedure. And it's very economical when we do it under local. So it's something I do like to tell people, look at what's aging you. Is it your lips? Is it whatever it is? And let's enhance that and restore it to the way you want to look.
No, I love that. Such amazing tips. And I love how you're kind of looking at, those certain, age spots for those people, for people. It could be the eyes, could be the lips, but you don't have to go crazy and do everything.
Right.
And I love how like you're so conservative about it. And it's so comforting. It's like, oh, you don't have to like turn on the full spigot of I need to drink from the whole fountain of youth and need to douse my whole body in it.
Right.
So that's really cool. I really like
Yeah. I like it that patients can dip their toe in, and just if they're interested, they just want to get educated. We can approach it from there too. I mean, you don't have to ever always do something when you go see the dermatologist. You can just get information and learn how to take care of your skin, see what kind of prescription medications that every person should be on, to kind of help maintain and keep it healthy. So I
that.
think that's important.
Yeah, and perfect time to be talking about that during at least the hot summer months for all of us as we're outside more, enjoying, and definitely going to be thinking about our skincare this summer. But all year round, that's what you really want to hear, all year round. So,
That's right. We do occasionally have specials, and right now for July, we're doing a take 10. So just kind of keeping it simple, 10% off most procedures like lasers, microneedling, aesthetics. Like we do facials and diamond glow facials, which are really nice microdermabrasion. So 10% kind of just 10% up for like the aesthetic lasers. And then like if you've never had Botox, $100 off. And then $100 off a filler if you want to try that too. So, it's kind of an easy way for people to check us out. And we're on dynastyderm.com. So we just revamped the website. So you can always hit us up there.
That's awesome. Really, that was gonna be my next question is like how can everyone find you? So you're on you have a great website and social media as well.
Yes. So I have my own personal Instagram handle, which is at Joanna Chan MD. It's just one word, JoannaChanMD. And then we also have a practice ones at Dynasty Derm, one word. And we just recently started having fun with social media, doing kind of funny reels. We do have some before and afters there also. But it's fun. It's nice to interact with our patient and our clients and just social media. And we do some community outreach also, and that's kind of posted there also.
Great. Well, this has been amazing wealth of knowledge. I think everyone this summer is definitely going to be thinking about their skincare, skin tips that you've given, and some things to think about the next time they make an appointment to see a dermatologist. So really appreciate it. And again, hope to have you because you're fantastic and loved everything.
Thank you so much for your time and nice to see everyone.
Thanks.